Dear Dr. Charryse, my opportunity to take a lot of the questions that you all try to slip in my DMs and do something constructive.
Dear Dr. Charryse, are y'all ready for this?
The goal is for us to have honest, courageous conversations, pretty much with no topic off the table.
Let's go.
Welcome to another episode of Dear Dr. Charryse. I'm always honored that you choose to come, to listen, and to share this message with other people. I spend a lot of time really thinking about and considering, what do we need to talk about? What do we need to get into? What often doesn't get enough shine or conversation? And today is one of those moments. I always feel like there's a little something for everybody in what I discuss, but today for me feels like one of the most important messages that I'm going to deliver to you. I want you to consider this. You can have a good life. You can be grateful and depressed. And I'm not pausing for dramatics. I'm pausing to let those of you that might need to hear that, let that sink in. So many times in various ways and in different situations and venues, I have conversations with individuals where they're being open and honest with me, and we're just reflecting in dialogue, and they will mention these undertones of sadness and struggling, and then immediately go, but I feel bad. I feel like I should be more grateful. Please don't let what your life is like make you, what's the word I want to say, diminish and dismiss and push off the fact that you are struggling. So as a result of that dynamic in the lives of the people that I have been talking to over years, but I'm hearing it more and more, I want to uncover and unmask some of the hidden or overlooked signs of high functioning depression. So let's get into a moment of teaching. I'm actually going to pull out my notes because I really want you to get this down. So high functioning depression, what is it and how does it differ from typical depression? So when we are working to diagnose someone with depression, we look at symptoms that they have described, and if those symptoms have been in place for at least 2 weeks, we then determine that's low, moderate, or severe depression. But even without a diagnosis, I want you to put that to the side and really just hear and listen and go, do you see yourself? Do you hear yourself in what I'm describing? Do you see someone else that you know that is important to you? Do you hear bits and pieces and signs and symptoms of what you're noticing in the people around you? Pay attention as I share these tips, tools, and this identity of high functioning depression and how it's overlooked for yourself, but also please check on your strong friends. And if you have strong friends in your life, you recognize you're going to have to be a little bit aggressive, or perhaps you are the strong friend for everyone. And if that's you, I need you to take your mask off for a moment and be honest with yourself. So individuals that are struggling with depression, basic symptoms, these are not all of them. These are the most general that people are aware of. Low mood, loss of interest in activities that would normally bring you joy. So you're starting to pull away or don't have the same desire to do things the way that you used to. Sleep and appetite changes. So that could be sleeping too little and eating too little, or an increased need for sleep, or appetite changes that are over in excess of what you would normally have on a regular basis. And those two can be tricky because there can be a number of things that also play into those changes. So I feel like a lot of people get caught up in their head, but again, just see these as a general overview as typical signs of depression. You may also find that you are struggling to concentrate and feel like you have brain fog. There's a part of you that knows exactly what you want to do and what you need to do, but then there's another part of you that is struggling to fire off, and then feeling worthless, even if you are doing a million things in a million places and handling it well. You will still have this internal feeling of worthlessness. Now, those are the general signs. We may ask questions, and if you have seen that in your life for 2 weeks or more, I'm going to need you to reach out and speak to someone. You are not okay. Even if you think this is your normal or it's a wave and it comes and goes, the things that I just described are not how we're intended to live. So then if you take those kind of common signs and symptoms and then put them in the place of someone that has high functioning depression, here's the difference. The individual with high functioning depression will look like they have it all together. They're still waking up every morning. They're still dressing to the nines or in whatever vibe they have. It all looks copacetic. On the outside, everything seems well, but internally, there is a firestorm happening. There is an internal struggle. And the challenge to individuals that struggle with high functioning depression is that you can't see it. We have to move away from the part of us that views depression like the movies. Someone laying in the bed and tearful and the blinds are shut and they're not eating, and all of that can be true, but you're not always going to have an opportunity to see that. Or if you're suffering from high functioning depression, you're not going to tell anyone sometimes that you don't want to get out of bed, that you don't want to face the day, that if you didn't have people or responsibilities pushing you to show up in life, that there is a part of you that would just disappear and no longer be a part of life. And I know that that's heavy, but that's truth. And here we're all about talking and revealing or unveiling what's beneath the surface. And this is real. And this may be something that you're struggling with in this moment, but it also is going to be something that a lot of people around you who you envy, who you compare yourself to and think they're so lucky and they have it all together and wow, things are finally going great for them. Those very people may be struggling down to their core. So, 7 overlooked signs of high functioning depression. Number 1, you're appearing to keep it all together and you're either consciously or subconsciously hiding the fact that you really want to fall apart from other people. And it could be for a number of reasons. You may feel like you don't want to be a burden to other people. Perhaps you feel like you don't want to worry people. If you are a parent, parents have a tendency to hide every part of their emotion from their children. And there's a balance to that. You don't ever want your children to feel responsible for your emotions, but it's important for them to see that you're real and that you struggle. You may also be in a situation where a lot is depending on you and resting on your shoulders. So you feel like it's not allowed. You can't give yourself permission to feel what you actually feel. Newsflash, it's going to be there anyway, and it's going to push you to address it. Number 2, individuals who experience high functioning depression may also feel a sense of guilt and constant feelings that you're not doing enough. I know it can be mind-blowing. And you could make a list of all of the different things that you do in any given day. And that list is super long. And there's still this gnawing part of you that thinks, I didn't do enough. I'm failing. I need to be better? What is wrong with me? Those are some of the statements that you may be saying to yourself, and it's speaking this internal narrative filled with guilt, because you also feel bad that you feel this way. And getting back to where we started, you think, I should be grateful for my life. I should be happy that things are a certain way. So you feel guilty because you're down. Please don't, if that's you. Number 3, you have a strong desire for escape, but a strong desire that's being masked by you still showing up every day. Sometimes you might even overcompensate and put yourself out there in multiple ways. But inwardly, you know, if life could stop, if you could check out of the day, you would be happy to. I'm going to add here, for the strong desire for escape, you may also be passively having thoughts of suicide. And that can be challenging to hear. I'm slowing my rate to let that sink in. Passive thoughts don't mean that you have an idea about how you're going to do it. You don't have an intention, but there is a part of you that thinks it would be so much easier if I wasn't here. And then you might pull yourself back into a moment of, no, that's not what I want, but that escape feels like an answer when you're overwhelmed. Which leads to number 4, feeling hopeless, not seeing a way out. You might be a person, or you might know someone that's struggling with high functioning depression, and they feel hopeless because there's a part of them that worries, well, what happens if I need a break? What happens if they need to slow down or do something different? If they feel like everything is on their shoulders, it may very well feel like a hopeless situation. It can also feel like a hopeless situation when an individual with high functioning depression feels like this has become their normal. Oh, I felt this way for so long. I'm starting to get used to it. Please don't get used to being depressed at any level. Number 5, negative thoughts. And this can be one of the most challenging aspects of high functioning depression internally, along with that passive suicidality, because you don't want to admit or acknowledge the degree, the intensity, the frequency of those negative thoughts. And the people around you may actually know you as someone who is dependable and positive. And you actually might be giving out true words of encouragement and strength to other people, but be struggling to internalize those same thoughts for yourself. Number 6, smiling depression. You still know how to work a room. You still know how to show up and genuinely laugh, but there's something about your laughter that doesn't have the same depth. It's almost like you can feel split and divided in 2 different places, where you're in the moment-ish and you're smiling on the outside and talking to people and doing all the things, but you know that just beyond that smile, your heart aches. You're exhausted. And you wonder secretly, can people see? And for the most part, they can't. So it's always going to be up to you to be honest and open with yourself. And number 7, lack of energy and motivation. High functioning depression operates off of a pseudo energy that is connected to your responsibilities. You have to get up in the morning because there's something in your life that is depending upon you. There are specific things that you have to do, and as a result of that, you find just enough motivation to take care of the things that are necessary. Here's how you'll know this is you on number 7. You have found the fuel to do the things that you need to do for others. But when it comes to what you need to do and desire to do for yourself, you have nothing. You are struggling. You can't figure out how to find that reset button, and that's how you know you're there. So if you've listened to this and then you've decided, ugh, Dr. Charryse, I see myself here. What do I do? Oh, there's so many things, but I'm going to give you a few. 1, move through the resistance. I mean that metaphorically, and I also mean that physically. It is so important for you to move your body. You may not have the energy to exercise the way that you normally would. That's also a sign of depression and high functioning depression. But I still need you to find a way to walk, to get outside in nature, to reset, to recenter, to do yoga, to dance to a song, to sway side to side and get into somatic movements that can help shake off some of what your system and your nervous system is feeling. Number 2, identify a daily purpose and let it guide you for the day. I want you to find at least one thing that feels purposeful for you. And not just something that you have to do out of responsibility, but something that you feel like, if I could do this one thing, I feel like I'm coming back to life. That could be scheduling an appointment for yourself. That might be sitting in silence outside while drinking something warm and non-alcoholic that you love. I say non-alcoholic because if you're struggling with depression, alcohol as a depressant will add to that, as well as other substances. So really being cautious of that. Number 3, find the balance between effort and ease. Getting out of what you're feeling isn't going to come about as a result of everything stopping. But it is possible to start moving towards a place where there's an ebb and flow of you're putting effort in your life towards the things that you know are necessary, but you're also backing away just enough to allow a little ease. So maybe that means you cut your day off an hour earlier or go to bed a little bit earlier. Maybe that means that you do allow yourself to sleep in a little bit more and listen and honor your body, but you find micro moments to insert ease and give your mind and your body and your spirit some level of reprieve. And then 4, tell someone the truth. Whether that is a trusted friend, a trusted clergy, a companion, a partner, a counselor, a coach, it is crucial if you're struggling with high functioning depression to let someone know you are struggling. It could even be coming up with a simple word, a word that you choose, and you let someone know, I really don't want you to get all into this, but I do need to have a way of letting you know when I'm having a hard time. So if I say this word to you, if I text this word to you, if I email this word to you, however you want to communicate it, that person at least knows how to be prepared to support you. But also make sure that you choose someone that isn't also struggling, and that you choose someone who is willing to kind of be in the boat with you. They're not looking to do the work for you. They can't. That's not possible. But you need that trusted person and that trusted space where you can reach out and get support. And of course, you can call the crisis hotline number, which is so helpful, and reach someone who is trained to support you at any given moment and time. I know today was heavy, but some days are like that. Life is heavy. Life is light. Life is fun. Life is all kinds of things, but I believe that this is an important discussion. Take a moment and replay it as needed. Share it with someone that you know they might be in a situation where this is true for them. I want you to hear this message. If everything else that I've said is a blur, I want to remind you in this moment, you are not too far gone. It is not too late for you to get help, It is not impossible, I promise, for you to feel better. It takes time, it takes work, it takes intention, and it takes us making changes in our lives. But all is not lost. If you've enjoyed our time today and you would like to connect with me on a regular basis, I want to invite you to come and spend time with me over on the Cadre app, which is social media for mental health. It's not a space that is overwhelmed and inundated with a lot of background noise. It is specifically centered for those in the moment moments where you need support. You can join me there by going to joincadre.com/Dr. Charryse. I'm there every Wednesday and Friday. There's also videos that you can replay, but I want to invite you to stay connected to me or whatever source that you need in order to support yourself well. I feel like this is a good time for us to end in one of my favorite ways. If you're comfortable, one hand over your heart, eyes open or closed, and reminding yourself that you are enough. Say it with me. I am enough. And all is not lost. Until we meet again, be well.